Welcome back to our last part of the behavioral physiology. So we were able to acknowledge that when it comes to behavior, you cannot totally ignore the limbic system out. And the limbic, when you focus on the limbic system, we have one particular interesting part, and that is the hypothalamus. So we are being told that the hypothalamus is a major control headquarters for the limbic system. And how is it able to do that? Other might say that hypothalamus is a controller. So a controller in a way that it integrates the emotional signals and maybe translate them into autonomic and hormonal responses. And when you think of the autonomic and the hormonal responses, this represents some physical kind of responses that might have a role that might have a complex role when it comes to the outward display of the behavior. So we'll be able to see specifically how is the hypothalamus able to do all these things. And one clue that you might have is that the hypothalamus might be able to do that because it has some various nuclei, it has some various pathways that allows information to move in a certain way. So for example, think of this, you are able to see the hypothalamic output pathway. So we have three, the backward and the downward movement, rather the pathways. We have the upward pathways, and we also have the downward into the infundibulum posterior pituitary gland. So you need just to know that one of the most important role that the hypothalamus is playing is actually an integrating or rather integration of the emotions. In that, we want you to be you see, we suggested that the limbic system is normally concerned with the emotions. But at the end of the day, we want these emotions to also have some translation into some physical aspect. So these emotions can, the signals from the emotions in the limbic system through the hypothalamus can get into the autonomic nervous system. And that means if you are having a fearful kind of emotions, let's say the emotion that you are dealing with is fear, the fear will get into the autonomic nervous system to excite the autonomic nervous system. And you might have now the autonomic responses, such as maybe increase heart rate, or maybe sometimes sweating, or having some increased respiratory rate. So that is an aspect of the autonomic response. And if you look at it keenly, sometimes these are aspects that you as an individual you are able to notice either internally or maybe from another person. So if somebody is having some increase, you might not be able to appreciate the heart rate, but you are able to see maybe an increased rate of breathing, where these people will seem as though they are having some difficulty or kind of panting. That is an outward behavior that is being displayed, but specifically being displayed through an autonomic response. Another thing that you also need to remember in the integration of emotions, after the emotion has been integrated, you can also get an hormonal reply, considering that the hypothalamus normally relates well to the anterior pituitary glands and the posterior pituitary glands. So that means some of the emotional neuronal triggers within the hypothalamus can be relayed to these centers, so that the body experiences an hormonal effect as a result of these emotions. And that's why we have these pathways. So specifically, let's examine each of these pathways. So number one of the hypothalamic output pathway are the backward and the downward pathway. So this is an integral part, especially you try to think of it as an, according to what we've said, hypothalamus able to integrate the emotions, and then using the backward and downward pathway These emotions impulses can be sent to the autonomic centers within the brainstem, so that we get the autonomic nervous response. So that response from the emotions can be affected by the backward and the downward pathway. So we also have yet an important pathway. We can refer this as upward pathways. So we have many tracts in, all these are represented as upward pathway. So that means within the hypothalamus, we can be having axonal projection superiorly, that some which ends to the not really the amygdala, but they are likely to pass through descend before they ascend using some of the cortical structure. If you are able to remember the cortical structures of the limbic, you will have a clue of what we are suggesting. But what you just need to know is that we have the upward pathways. So that means we are having tracts within the hypothalamus extending to the higher centers of the brain. So the main goal here is to send some neuronal projection up to the cerebral cortex. So to the diencephalon and the cerebrum, especially the anterior thalamus and the limbic cortex. So that means, so let's just highlight some of the previous examples that we had. So why is this upward pathway very important, specifically when it comes to the hypothalamus? So this can be important in the regulation of emotions. We want you to regulate the emotions, and also regulation of the behavior. So minus this pathway, this role is not possible. And how is it able to achieve it? We've said that the hypothalamus is acutely aware of the emotional states, or the emotions can be integrated at this area. So let's say you are having some form of emotion such as maybe fear, pleasure, or hunger. So those emotions represent some form of signals. So these signals can move from the hypothalamus and advance maybe to the one of the limbic structures such as the amygdala, and get to the cingulate gyrus. So from there, the information can go all the way to the cortical region. Remember, the cingulate cortex is just is part of the cerebrum. So that means once the signals are there, the individual is able to be aware of the particular emotions. So that means minus this pathway, yes, the emotions might be there. The person could be fearful. The person could be having some form of pleasure or many emotions. But at the end of the day, you as an individual, you need to be aware of the emotions that you're having. So if you want to be aware of that emotions, that means these emotions needs to be relayed from the limbic part, which is the hypothalamus, eventually through the cortex. And the cortex, the immediate part of the cortex is the limbic cortex. So a good pathway to illustrate that is the what you can refer to as the hypothalamus let me just write it to sound easier. Hypothalamo amygdala pathway. So hypothalamo amygdala pathway suggests that information from the hypothalamus will be relayed to the thalamus. Remember, thalamus is a relay unit. Most of the time, you cannot get to the cortex without passing through the thalamus. So you're passing through the thalamus, and this time round, a specific nucleus within the thalamus should be the anterior thalamus nuclei. So the nuclei at the anterior part are likely to be used. so that you eventually get to the cortex. So remember, one of the limbic cortex could be the cingulate gyrus that can sprout out signals all the way to the prefrontal regions or to the various areas of the cerebral cortex. So once we've had our impulse, or rather our signal, into the cortex, an individual is able to be aware of whichever emotions that they are feeling. If there's a fear, if there's fear, they'll be aware. If there's pleasure, they'll be aware. I want you to think of this in this way. Just think of an individual who is having maybe an increased heart rate, difficulty in breathing, not necessarily difficulty in breathing, but they are having increased respiratory rate. And when you assess, or maybe when you interact with this individual, they are not aware why they are feeling whatever they are feeling. They are not aware of maybe the difficulty in breathing. They are not aware of the heart rate that maybe they are experiencing. The awareness that I'm talking of, they are not really emotionally aware why they are having an increase. They are having an increased maybe heart rate or an increased respiratory rate. And maybe because they are feeling that, they are thinking of these things. Maybe they are thinking of those autonomic signs as maybe signs of symptoms, as maybe symptoms of a physical disease. So that can be true, especially if we are not having an adequate relay of information up to the limbic cortex or up to the cerebral cortex, because we want these people to be aware that I am having some fear kind of emotion, I'm having some pleasure kind of emotion, and I'm having several emotions. And it is because of maybe these emotions, that's why I'm having these autonomical responses. So sometimes somebody might just be aware of the autonomic response, but not really acknowledge emotions. This can be true, especially for individuals with generalized anxiety, where where these people are just aware of the autonomic symptoms, but if you tell them they are anxious, they'll doubt you because they are not really able to appreciate the anxious state within their emotional space. And we are just having a proposal, a physiological proposal, that sometimes if this is not as adequate, we can have that kind of phenomenon. So that is one of the upward pathway. Another, and we are seeing it very crucial in regulating the emotions and the behavior of the individuals. So the two pathways that are very important within the upward pathway, it is the hypothalamo amygdala pathway that allows individuals to be aware of the emotions. We should also be having another pathway. We also have the hypothalamo cortical pathway. It is actually just a part of this to acknowledge that eventually this hypothalamo amygdala pathway can be extended all the way to the cortical to give us now a good pathway that controls our emotions and behavior. Why are we suggesting control of behavior and emotion? This is because once the signals have reached the cerebral cortex, remember that means you are now aware. So if you are aware, at least now you can, as an individual, you can decide, or you can make a decision on what to do to control such behavior. So let's say you are having some fear kind of emotions. Maybe it is true because there's some physical danger that you've seen. So this fear emotion will be relayed to the limbic cortex and to the larger cerebral cortex. You become aware of this fear. So after being aware of this fear, you might decide to move away from the stimulus that is causing that fear. Maybe you are a person who is scared of monkey, so you might flee away from the monkey, and that is a behavior that we are likely to see. Or better put, you can also decide to because maybe you are having the fear, and you might not really move away from the stimulus. Your cerebral cortex might decide now to control this fear in a way that, or maybe control the autonomic symptoms of this fear, where you might decide to maybe slow your breathing, slow your rate of breathing deliberately by maybe taking in deep breaths and deliberately relaxing. And that is the control that you are suggesting. All these are possible only through the signals that we are seeing. And maybe lastly, as part of the upward pathway, they are also very important in the influence of memory and motivation. So this should make more sense, or much sense. I remember we suggested that the brain does not just store any information. It has to store an information that makes an emotional sense to it. And we suggested that the limbic system can play an integral part when it comes to that, to the storing of information, because if you are getting an impulse that which does not appeal to maybe the body or to the brain emotionally, you might end up not storing it, unlike impulses that appeals to the brain emotionally. And remember, emotionally, it doesn't need to be a pleasant kind of emotion. It can equally be a bad kind of emotions. So that is an important part of the limbic. And why specifically is the upward pathway very important? We have a specific pathway by the name mammilothalamic tract. So let me just write it over here. It won't be as clear. Mammilothalamic tract. So that means mammillary body. Remember, these are also part of the limbic system. So we are having fibers, or rather tracts, projecting from the mammillary body all the way to the thalamus. And if you can remember, this is part of the Papez circuits. Part of the Papez circuits. Remember, the Papez circuits are represented how limbic structures are connected, maybe from the hippocampus, circulating through the cortex, getting through the mammillary, the thalamus, and then back to the cortex. And remember, when we are suggesting the cortex, we are talking of the limbic cortical structure. And from the limbic cortical structures, this can spread to involve the entire cortical regions of the brain. So the Papez circuit was very important for some emotions and memory. So one of these pathways are the mammillothalamic pathway. So that means from the mammillary body, we want to advance to the cortex. But before we get to the cortex, remember, you need to pass through the thalamus. So this is an important pathway that enhances some form of memory. Last but not least, we also have the downward pathway that gets into the infundibulum. So this is very crucial, especially when it comes to the hormonal reply. Remember, we just have a summary and suggested that hypothalamus can be referred to as a controller. A controller in that it integrates the emotional signals and translates them into autonomic and hormonal responses. So while the backward and the downward pathways can control the autonomic response, the downward pathway, specifically to the infundibulum, normally controls the hormonal response. And this suggests that some signals from this area go straight to the infundibulum, where now it can influence both the anterior and the posterior pituitary glands. So if you remember in our endocrinology, most hormonal system were respecting this hierarchy, where we are getting influence from the hypothalamus, influencing the pituitary glands, and now the subsequent endocrinal organs, or maybe even some organ directly, as we are able to propose with the growth hormones. So this is a good connection, so that at the end of the day, your emotions affects you physically. It can affect you autonomically, or it can affect you in a very hormonal way, so that you will understand that at some certain hormonal, at some certain emotional state, you anticipate maybe some surge and decrement of some hormones that might again affect your behavior. So just as an emphasis, after inspecting all those pathways, the three major pathways, output of course, you can summarize the hypothalamus to be functions as vegetative, endocrinal, and emotional behavior. This is despite it being 1% of the mass of the brain. So it is a very small part of the brain, but controls huge hemostatic functions of the body. So that is with the vegetative functions, where you want to make sure that the temperature of the body is okay. Remember the osmoregulatory roles that we are also able to suggest. All these are actually being affected largely by the hypothalamus. So despite being a very small organ, it is very, very crucial. And we can confirm that, especially in some disease states, where you can, I don't want to suggest lack of hypothalamus, but I want to suggest lack of some part of the hypothalamus, where that can actually compromise some of the physical behaviors, or maybe compromise some of the behaviors that we'll ordinarily anticipate in normal people. So the pathways are important, and not only the pathways. We also have specific nucleus within the hypothalamus that perform specific roles that we've been able to mention. So these roles could either be behavioral roles, emotional roles, and the vegetative roles that we've suggested, and some stretching to the endocrine. So for example, this is the hypothalamus, and you're able to see various nuclei as labeled over here. So maybe you can start with what we know. In our endocrine system, we suggested that the hypothalamus has some various nuclei. This was especially true, especially when we were relating the hypothalamus to the posterior pituitary gland, where we suggested the posterior pituitary glands will not ordinarily produce hormone, but will release hormones that were manufactured, or that were that were made or synthesized within the hypothalamus. And we were referring to two major nuclei, the paraventricular nuclei and the supraoptic nuclei, where we suggested that at the paraventricular nucleus, they'll be able to produce oxytocin, and then this oxytocin using the axonal, the axon spreading from the periventricular nucleus, descending all the way down to the posterior pituitary glands where they have the axonal end. They'll be releasing the oxytocin at that level. So that was also true to the supraoptic nucleus, which was supposed to produce the vasopressin or the antidiuretic hormone, which spreads its axons, extending inferiorly all the way to the posterior pituitary gland where they have the axonal end, releasing the vasopressin, where we know both oxytocin and the vasopressin have some various autocrine or maybe endocrinal role. So these were just these two nucleus, the periventricular nucleus and the supraoptic nucleus. So as we are transitioning to the nervous system, we are also able to see the various parts of the hypothalamus. So that means on top of these two nucleus that were very important in the endocrine, we also have other nucleus that controls the various functions of the body, which we've agreed they can be vegetative, they can be endocrinal, or they can have some emotional aspect and the behavioral aspect. So I just want us to see a few of these. We have the dorsomedial for GI stimulation. We have the posterior hypothalamus with the various nucleus. You can see the various roles that they are playing, increasing the blood pressure, papillary dilatation and shivering. So this will tell you that it is likely that they might send some signal to the brainstem to directly influence the autonomic roles that we anticipate. We have the periphonical nucleus that controls the anger, again, increased blood pressure, rage, ventromedial nucleus, mammillary bodies, and many nucleus. I'll again say that the role of this nucleus can be emphasized, especially in disease process. So if you have a disease process, so a good example, let's say you're having maybe a lesion at this nucleus over here, the periventricular and the arcuate nucleus. So we anticipate some deficit in terms of you could you'll not be able to control your hunger. You might not be able to control this satiety. You won't be satisfied with just eat and eat. You might also have some endocrinal compromises. So let's just focus into the major nucleus. So we have another view, but this is still the hypothalamus with various nucleus. So sometimes this is a very sometimes it can relate to the thalamus, in that also the thalamus, as we were able to see, it had various or a lot of nucleus that performed different role. But while the thalamus is normally a relay station allowing signal to move from one particular area of the brain and extend to another, it's normally referred as a relay station. But we've seen the hypothalamus is referred to as the controller. It is able to control or integrate some emotional state to give us both an autonomic and hormonal state. And of course, we expect some fibers to extend from the hypothalamus all the way to the higher regions of the brain. So that is the cerebral cortex. So that by the end of the day, you'll be aware of your emotional state. If you are having some form of fear, you'll also be able to acknowledge. I know we have many nucleus, but I want us to focus onto some various nucleus that are very important within the hypothalamus, specifically those which are very important for their behavior. Remember, we are still on the physiology of the behavior. So let's examine the behavioral function of the hypothalamus and the associated limbic structure. Behavioral effects of the hypothalamic stimulation. So beyond its role in vegetative and endocrinal control, the hypothalamus strongly influences emotional behavior. Stimulation of different regions leads to distinct behavioral responses. We were able to see the various nucleus within the hypothalamus. So what we are suggesting is, if a specific region or a specific nucleus within the hypothalamus is stimulated or fired electrically, we should be able to anticipate a specific behavior. And the same will be true. If a specific region is underfired, maybe because of some lesions or a disease process that affects these tracts, we might be able to see some deficits. The specific nucleus that we are referring to, number one, the lateral hypothalamus. So we are suggesting if this area is stimulated, an individual is going to experience some hunger. An individual is going to experience some thirst, and they can generally be active. So what does that mean? If you have a disease process within the lateral hypothalamus, it means that you might not feel some hunger, you might not be thirsty, and you might not be active. So what are we getting from here? What we are getting is, when these nucleus are disrupted, we are likely to have some different behaviors. So different behavior. So what happens when you are hungry? You are likely to eat. So depending on your level of eating, so if you are eating excessively or not, that is a specific type of behavior that you are displaying. How you are drinking water. And remember, to thirst, it is not necessarily confined to water, even though water is what you are likely to go to, but you can think of it as drinking. You'll be displaying a drinking behavior, which can be excessively, or it can be extremely low, depending on how these areas within the hypothalamus are being fired. We are also told that when the lateral nucleus of the hypothalamus are triggered, the individuals are likely to display some rage and some aggression. So think of individuals with excessive expression of aggression. So these are individuals who are overly aggressive, who are overly displaying some rageous behavior. So that can be possible if this area are overstimulated. And remember, rage and aggression are not necessarily a bad thing, even though when you have an extreme form, of course, they can be bad, because they lead individual to display some destructive behavior. Even though it is normal to have a bit of rage and some bit of aggression, because at least they can allow you as an individual to respond to some situation that might require you to have a bit of rage. So it can be good to an extent, but we don't want an extreme form of it. So these are behaviors that we are seeing when the lateral hypothalamus is stimulated. We also have the ventromedial nucleus, which most of the times tends to give us an opposite action of the lateral hypothalamus. So what does this suggest? It means that we should be having equal stimulation of the lateral hypothalamus and the ventral medial nucleus of the hypothalamus, so that we are able to display a balanced behavior. So what specifically does the ventromedial nucleus do? It promotes satiety and reduce food intake. So if you are an individual who is eating, if this area is well stimulated, you'll be satisfied with food. If you are having a lesion in this area, you might end up overeating. And to a behavioral level, you might express the behaviors that are normally associated with binge eating, binge drinking, and many other behaviors that revolves around food and water acquisition. And why are we bringing this to behavior? This is just telling us that sometimes, in as much as you might want to control the behavior psychologically, we are just appreciating that some behaviors which are maybe maladaptive can stem from a physical cause such as lesions in this area rather than some psychological interactions. So the ventromedial nucleus also important in calmness and tranquility. So if this area is well stimulated, you will be calm and you'll be having some sense of tranquility. So that means at least you can be able to control your emotions. So just think of some state where maybe you're having a lesion in this area. So if you're having a lesion in this area, it means that with some little provocation, you want to be able to control the lateral hypothalamus. You'll just be aggressive. You'll just display some rage and aggression. And you might display a behavior of a person who loves to fight. These are people, even if you look them in a certain way, it is likely to trigger them. Why are they being triggered? They are having a lesion at their ventromedial nucleus that is not able to calm them down. So we are seeing the exact opposite of the lateral hypothalamus. Another nucleus within the hypothalamus that is very important in determining our behavior, it is the periventricular nucleus and the central gray of the mesencephalon. So this is somehow equal. Remember the gray aqueductal gray area where we are using the opioids or the enkephalines. So this area, when it is stimulated, it is likely to elicit some fear and punishment response. And I remember we suggested that some of the behavior that you can see in the society, especially when these people are having a lesion in the periventricular nuclei, they might display something. It is not mocking, but they might display something like this. We are very fearless. Just think of a person who is fearless. I'll give you an example. Think of a thief. A thief who have survived several mob justice, and of course, before you get to mob justice, it is possible that maybe the mother or the father tried to discipline this individual, at least by naturally trying to instill some fear and some punishment. You see, human beings tend to learn more from fear and punishment rather than from reward. So it is natural for us to have some fear. But we can have a worrying trend if you are a fearless person. A good example is a thief who has survived several mob justice. So that means this area was not well excited. So these people are likely to continue with a specific kind of behavior, such as stealing. This is because they did not learn from the fear and punishment that happens to most people. if not 90% of us. So they'll continue to display this kind of behavior. So sometimes, rather than, if you want to help this individual, maybe they could be having a problem at the periventricular nuclei, whereby, they are displaying the stealing behavior, but they've not learned to live the stealing behavior. And one way of learning is from instilling fear and by punishing individuals. So if they are having lesion in this area, it means that they'll not be able to acquire that kind of learning that requires some fear and punishment. And these people might end up displaying a behavior that you desire very much to correct. So we also have the anterior and the posterior area of the hypothalamus. So these are very important in the sexual drive and arousal. So you could be having the perfect genital, you could be having the perfect romance, but at the same time, you might fail to erect. This is because you are not having much of the drive. Remember, we suggested that for somebody to have a good erection, whether male or female, they'll need some physical arousal together with some endocrinal, not endocrinal, but neurological kind of arousal that should be stemming from this particular area. So if this area has some lesions, it means that you might not be able to have some good erection. So these are very important for the sexual drive and arousal. And all these are the behaviors that you are likely to see among a patient, especially when you are having some deficit in this. And we can just emphasize the importance of this area, especially when an individual experiences have some lesions. So just as I mentioned, lesions in the hypothalamus usually produce effects opposite to those seen in the stimulation. For example, the lateral hypothalamus, which we suggested that they should be giving us some form of rage, aggression. They should be able to improve our acquisition to water and food because they increase hunger and thirst. So when you're having a lesion in this area, we'll see the exact opposite with our patient. And this is marked reduction in eating and drinking, which might lead to starvation. So this individual might be, of course, they are likely to be underweight, and they'll be displaying this behavior of not wanting to eat. So sometimes, if you're not keen, you'll qualify these people as to be having some depressive episodes. Well, the depressive episode will not be a lie. This is because we suggested that, again, when you're having some lateral hypothalamus lesions, you might not be overly active. So that means you might be having some passive tendency. So that means you as an individual, you display a behavior of poor motivation. You just want to sit, you just want to lie down. This is because you are not motivated. Your drive is basically low. Why? The answer is the lateral hypothalamus nucleus are normally responsible for the overall activity of the brain. So if you are not active, it means that you'll not be motivated and you'll not be having drive to perform the various things that you should be doing in this life. We also have the ventromedial hypothalamus lesions. So when you have a lesion, you expect the opposite. You are a person who will be overeating, overreacting, excessive drinking. You'll be hyperactive. You'll be displaying extreme rage even with slight provocation. These are behaviors that are stemming from a compromised area within the hypothalamus. Lesions or stimulation in the other limbic structures. So the other limbic structures are also very important. So scientifically, it's been proposed that areas such as the amygdala, septal areas, and part of the mesencephalon may produce similar behavioral effects as those seen with the hypothalamic disruptions, even though you are likely to experience it with major degree or with major intensity, massive intensity, when the hypothalamus nucleus are disrupted. Remember, when we were talking about the memories, we suggested that the brain has a way of deciding what is important and what is not, and then consequently committing that to memory. An important part that was charged with that specific role was the limbic system, where we suggested that you experience or any stimulus that your sensory part is interacting with, at the end of the day will be committed if it has some emotional significance. And we can go further and decide and maybe classify it and say that the emotion significance that we are referring to can majorly be divided into two, whether it has some form of reward or it has some form of punishment. So anything that has any sensory stimulation that you are experiencing and has some form of reward emotionally, it will be stored into the brain as a memory. Anything that has some form that gives some form of punishment will also be committed into memory, and this is what we are suggesting that the sensory signals that an individual is receiving is having some emotional significance. And the same is true when it comes to learning, because when you commit something to a memory and later be able to produce it, we'll say that you have somehow learned. So this can also stem from the psychology, where again you can suggest that an individual is likely to learn through reward and through punishment. But in this segment, I want us to maybe focus on this aspect. So where we are agreeing that while an individual can learn from both reward and punishment, we'll want to examine what circumstances are individual likely to learn from more. So we are having reward versus punishment. So several limbic structures are responsible for interpreting emotional or the affective value of the sensory experience. Whether something feels pleasant, it will be categorized as rewarding, or unpleasant, it will be categorized as punishing. So we have specific centers within the brain that can acknowledge sensory experience or stimulus that might be having a rewarding effect. And there are those specific centers that acknowledges the sensory experience or stimulation that could be having some unpleasant effect. So those that acknowledge the rewarding effects can be referred to as the rewarding areas or the rewarding centers. So these specific areas of the brain, when they are stimulated, an individual is likely to have some form of pleasure and satisfaction. And if an experience is giving you some pleasure and satisfaction, you'll definitely not forget about it. We also have some centers within the brain, the punishment areas. If these areas are stimulated, you are likely now to have these unpleasant effects of the sensation. This could be fear, pain, terror, or escape behavior. So escapes could be adaptive or maladaptive behaviors. The intensity and the location of stimulation within this system strongly influences the animal behaviors. So where we are now agreeing that you'll definitely learn if you are getting some reward or when you are getting some punishment. But we want to examine which aspect you are likely to learn from more. Is it those that brings the reward or the punishment? So let's examine the reward centers of the brain. So we have some specific nucleus within the brain that represent the reward centers. So that means that if these areas are excited within the brain, you have some tendency to feel good. So we are suggesting that the neuronal sensation or the impulses that sensory impulses that should be giving you some reward, they normally go straight to the reward centers and not to the punishment centers, so that at the end of the day you feel good with the sensation that you are getting. So this has been affirmed in a particular research. So researchers studying the monkeys discovered the reward and the punishment centers. This was done by implanting electrodes in different regions of the brain. So where monkeys could self-stimulate these areas by pressing the lever. If stimulation felt rewarding, the monkey will press the lever repeatedly and even choosing stimulation over the food. Why are we bringing food over here? This is because food can also give you a pleasant experience. And this animal is choosing to stimulate or to press the lever over the food. So this can actually tell you that we are feeling even much better when pressing the lever. It is just like comparing maybe something like sex to food. So some people they rather have sex and maybe food later. So it is the level of reward that we are referring to. So this stimulation, this area being stimulated is giving these people or this animal a reward, and because of that, they are repeatedly pressing a lever just to feel good. During this experiment, some of the specific area where these electrode implants were placed were within the brain were the medial forebrain bundle. So these are the lateral and the ventromedial medial hypothalamic nuclei. We also have the septum, amygdala, and parts of the thalamus, basal ganglia, basal tegmentum of the mesencephalon. So we are suggesting that if these areas are stimulated, you end up feeling good. And because you are feeling good, you want to re-stimulate this area over and over again. So one of the hypotheses that we are having is most of the impulses that you are likely to enjoy are likely to terminate at the rewarding centers, where this could be the lateral and the ventromedial hypothalamic nuclei, the septum, amygdala, thalamus, the basal ganglia, some areas that is, and basal tegmentum of the mesencephalon. So interestingly, some areas like the lateral hypothalamus can evoke reward at low intensity, but rage and punishment at a stronger stimulation level. So we're having some degree of stimulation. So if you're able to remember what we discussed with the lateral hypothalamus, we suggested that when this area is stimulated, an individual is likely to display some rage and some form of aggression. So if you excite a reward center, you'll feel good and you likely repeat that behavior that made you feel good, or which we are basically saying that you are learning. We also have some punishment centers. And this again was done using the same experiment, but using an inverse setup. So rather than implanting the electrodes to the reward centers, this time round they were implanted to the punishment center, so that when the monkey presses the lever, rather than feeling pleasure, they'll feel unpleasure, or maybe they'll feel an intense discomfort. And therefore, what will they do? They'll stop pressing the lever. They end up stopping the lever. And I want you to note this. So this is despite the monkey previously pressing the lever continuously to feel the good sensation or the good reward. But this time round, the same lever, because it is giving them a lot of discomfort, because they are experiencing discomfort, they decided to stop the lever, uh, forgetting all the reward that they felt. They'll just stop. This is also can also be committed to memory, in that you want to remember situation that's made you feel bad as a person, and after that you'll deliberately ignore those or maybe avoid those situations. So let's continue. When these punishment centers were stimulated, the monkey felt, instead of pleasure, they felt displeasure, they felt some fear, they felt some terror, they felt some pain, some sickness, and all those unwanted emotional reaction. So all this makes the monkey to stop pressing the lever, because these are experiences or emotions that we don't want to experience repeatedly. And most of the time, we intend to do everything to avoid these emotions. So this is despite maybe not that you're avoiding these emotions, but you are avoiding the stimuli that is giving you this emotion. So this is despite keeping into mind that the same stimulants can also give you reward, but if it has some negative aspect, you'll end up ignoring everything with this stimulus. So this giving you somehow a say that animals and human beings are likely to learn more from the punishment centers, or much more from discomfort, rather than from the reward that they should be getting. So according to the experiment, some of the key areas that were being stimulated for the individuals to have the intense discomfort were the central gray area around the aqueduct of the sylvius in the mesencephalon. So remember the painkiller system. The periventricular zones of the hypothalamus and the thalamus. To a less potent, the amygdala and the hippocampus. So it is good to note that stimulation of the punishment centers can override the activity of the reward centers, and showing how fear and pain dominate over pleasure in regulating behavior. And this can also apply to into our modern society, where an individual maybe has been helping us for the longest time, giving us some goodies. So if it happens that just one time this individual changes and displays maybe rather than giving us some goodies, they end up punishing us in a very cruel way. So we are likely to remember this individual as maybe bad people. We'll remember them for the bad things that they did, rather than for the good things that they did to us. Ignore the pretense that is likely to come in some funeral. But individually, when these people are alive, you are likely to avoid them for the bad things that they did. So you are likely to learn from the bad things rather than from the good stuff that this individual had. In fact, you'll have some reactional thoughts or some rationalization psychologically, and suggest that maybe they were just displaying this good behavior to put you in a trap. So that's the nature of human being. So what are these rage and the punishment centers? So rage is a defensive and aggressive emotional state triggered by stimulation of the punishment centers in the limbic system. So we suggested that rage is not an entirely bad thing, but it should be a protective, it should be serving a protective role. So stimulation of this might lead to rage and response characterized by defensive posture, extended claws, tail elevations, tail hissing and spitting, growling, pillow erection, dilated pupils, savage attack on the slight provocation. And remember, as scientists, we know that you can use this, you can say it is normally survival for the fittest. And if you are the fittest, it means that you should be able to acknowledge some danger and contain the dangerous situation. And sometimes containing, it means that you could be required to fight. You'll not be able to fight if there's no a general stimulation of the lateral hypothalamus nucleus. And these are very important. And remember, when these areas are stimulated, they are giving you some bad emotions. So this is giving where you can say that it's like the situation or the stimulus is kind of punishing you by instilling these bad emotions. And how should you be behaving? Sometimes now these bad emotions should be able to protect you, because if somebody is inflicting some pain on you and they are seeing you frowning and seeing you displaying all these kind of bad emotions, at least just from that, if there are people who are able to see, they can stop just based on that. So somehow they can just be protecting. So what are the importance of the reward and the punishment in the behavior? So human and animal behavior is largely guided by reward and punishment, where a reward encourages us to repeat certain behaviors. Punishment causes us to avoid them. So this makes the reward and punishment centers in critical regulating of some behaviors, or regulating drives, motivation, aversions, decision making, and overall behavior. Tranquilizers like chlorpromazine affects the behavior by inhibiting both reward and the punishment centers, resulting in reduced emotional response and less affective reactivity. So this helps in psychotic state by dampening the overactive areas of the hypothalamus and the limbic system, which are responsible for the extreme behaviors. The importance of reward or punishment in learning and memory. So this is habituation versus reinforcement. Habituation, where we suggested if a stimulus neither rewards nor punishes, it gradually loses its impact on the brain. Even though the cerebral cortex initially responds to the new stimulus, repeated exposure without consequence will lead to extinction of that response. The animal or the human ignore the stimulus that is not learned or remembered. This is what we say, where we say that a sensory stimulus might have some, should have some emotional significance. And we've gone ahead to divide this emotional significance as either reward or punishment. So it is habituation versus reinforcement. So if the experience that you're experiencing is not giving you a reward or punishment, you won't be able to remember it, or you won't be able to learn, or you won't be able to commit it into your memory. While this could be true if it has some reward or punishment effect. And in psychology, this can be narrowed or can be related to either reinforcement, which could either be positive reinforcement or negative reinforcement. So positive reinforcement is likely to involve the reward centers, where negative reinforcement is likely to involve the punishment centers. While in psychology, we'll prefer to use the positive reinforcement. This is because people are likely to learn, not that they are likely to learn. You'll definitely learn even in the presence of fear. But a good adaptive way of learning is through the reward. So if a stimulus does not cause a reward or punishment, it triggers progressively stronger responses in the brain upon repetition. So this leads to reinforced memory formation. The brain prioritizes this stimulus because it has emotional or survival significance, and that is with the either the reward or the punishment. So what is the role of the limbic when it comes to the behavior at large? The reward and the punishment centers, which are part of the limbic system, as we've been able to see, normally play a filtering role in what gets to be remembered. They help the brain decide which inputs are important, worth learning, and which are not. This filtering is efficient, and over 99% of the sensory inputs are normally discarded. The implications in learning: emotional significance, whether positive or negative, enhances memory. Effective teaching and learning strategies often incorporate motivations, feedback, and consequences to engage this system. A stimulus without relevance or meaning is easily forgotten, and we can all take advantage of that when it comes to learning. So just briefly, the specific function of the other parts of the limbic system. So what are the function of the hippocampus? Anatomy and connection. The hippocampus is a curved structure in deep medial temporal lobe, forming part of the floor of the lateral ventricle. It lies in the amygdaloid nuclei, fuses laterally with the parahippocampal gyrus, forms part of the hippocampal formation, including part of the temporal and the parietal lobe, has indirect connection to the cerebral cortex, limbic structures such as the amygdala, hypothalamus, septum, mammillary bodies. Communicates outputs via the phonics, especially to the anterior thalamus and the hypothalamus. The sensory integration and the behavioral response. So almost any sensory stimulus activates some part of the hippocampus. The hippocampus helps channels sensory input into to initiate behavioral responses such as the pleasure, rage, passivity, sexual drive, emotional influence, emotional and the motivational state. So that means we've been able to see how the hypothalamus is functioning. So we'll presume that much of the sensory impulses that is coming to the hypothalamus, so that an individual is able to learn as the way we've suggested, by either stimulating the reward or the punishment center within the hypothalamus. The gateway will need to be the hippocampus. also have some hyperexcitability and seizure activity. Hippocampus is prone to hyperexcitability, so mild electrical stimulation can trigger focal seizure, lasting several seconds. Stimulation can also result in the psychomotor effects such as hallucination. So this could be olfactory, visual, auditory, or tactile hallucinations. So the person remains conscious but cannot suppress the hallucinations. Some regions of the hippocampus have only 3 cortical layers, where some have 6, possibly making it more excitable. So those with more cortical layers are likely to be more excitable, unlike those with the 3. So still at the hippocampus, we suggested that is very important when it comes to the memory. And we suggested that when there's some form of lesion, a person might experience some antegrade amnesia. So what is the role of the hippocampus in learning and memory? So it can be important in the short term and the long term memory. So people with the bilateral hippocampal lesion, or when their hippocampus is removed, might influence how they retain their old memories, lose the ability to form new long-term memories, maintain short-term memories for seconds or up to a few minutes, a condition called the anterograde amnesia. So the hippocampus might not have much effect to the old memories, so they might just be there. So it is not normally associated with some retrograde amnesia. How does the hippocampus consolidate the memory? So we discussed this, but just as a reminder, the hippocampus drives the conversion of short-term memory into long-term memory, and may be due to the repetitive rehearsal, that is reinforcing new information until it is stored permanently. Without it, consolidation often fails, especially for verbal or symbolic information. Evolutionary insight originated as part of the olfactory cortex in the lower animals. Early role was actually very critical in life, critical decision just based on smell, whereby you can see some animal with poorly developed prefrontal cortex, where they can chiefly rely on some smell to make some decisions. Evolve into decision-making centers, flagging important inputs for learning and memory, act as a filter for promoting memory, for experiences like pleasure or pain, while ignoring the neutral stimuli. So that is what we refer to as the habituation, as we've been able to see. Other parts of the limbic system, we also have the amygdala. This is a group of small nuclei located beneath the cerebral cortex at the anterior end of each temporal lobe. It has a bidirectional connection with the hypothalamus, hippocampus, thalamus, septum, limbic cortex, and also the neocortex, especially the visual, auditory, association areas of the temporal, the parietal, and the occipital lobes. And this is very important in that we want information to get from the cerebral cortex to the limbic system through the amygdala. Remember, we suggested that these sensations, we also want them to have some emotional aspect. And for that to be possible, you need to place the amygdala in picture, in that we are having amygdala having a way in which they can make some neural connections. What are some of the input and the outputs? It receives input from the limbic cortex, and some sensory areas. So that means it is also charged with emotional integration role. It sends outputs to cortex of the same area, so emphasizing the bidirectional kind of connection, receiving an input from the visual area of the brain and giving it back to the visual area, so that some things that you are seeing, let's say you are seeing something, after seeing something, impulse gets to the amygdala. Once in the amygdala, back to the visual area. So whatever you are seeing is able to make an emotional sense. So what you are seeing is making you feel some form of pleasure, or giving you some form of sadness, possibly prompting you to even cry. So that is amygdala for us. Connects also to the hippocampus, septums, thalamus, and the hypothalamus. So what happens when the hypothalamus is stimulated? Just like what we saw with the hypothalamus, when they are stimulated, it is also able to influence some endocrinal and autonomic role. So this is possibly through the hypothalamus. So where you'll see changes in the blood pressure, heart rate, the GI activity, micturition, pupillary size, and also piloerection. Hormonal secretions such as the ACTH and the gonadotropins. Motor and the emotional effects. When this area is stimulated, you're likely to have some tonic movement, such as in head racing, cyclic, clonic movement, feeding related movements, such as licking, chewing, and swallowing. Emotional behavior you are likely to display, such as rage, fear, punishment response, reward, and pleasure. Also can be good for sexual behaviors, some directly, some indirectly through the hormonal. This could be erection, copulation, ejaculation, ovulation, uterine activity, and also in the premature labor, because it's somehow activating the uterus. You can emphasize the role of the hypothalamus, especially when it is not there. This can be a representation of a clinical psychiatric or neuropsychiatric condition by the name Kluver-Bucy syndrome, where individual is likely to present with some form of fearlessness, hypercuriosity, oral fixation, rapid forgetting, and hypersexuality. So these are some of the things that are likely to be displayed when the amygdala is not there. And a good clinical description of this disease is the Kluver-Bucy syndrome, whereby it is associated with these symptoms, whereby your control is extremely low. You are, I don't want to say, but let me say, somebody is almost behaving like an animal, where you are having some form of fearlessness, hypercuriosity, where you are just exploring things without caution. Just think of somebody who is seeing a naked live wire, and they are very curious. They end up touching it and they get electrocuted. So that's a symptom of a Kluver-Bucy syndrome. So it is not good. You rapidly forget. When you are rapidly forgetting, it means you are not committing things into memory, and you won't be able to learn. So if you survived that electrocution, you will end up again retouching that area or that wire without remembering what happened. You'll have some tendency to put things into your mouth. You get a pen into your mouth, anything into your mouth, you'll be having some hypersexuality behavior. And most of the time, those not that the libido increases, but you are displaying inappropriate sexual behavior. Not necessarily not necessarily what is this right term? not necessarily that which does not relate to your society, maybe that which the normal sexual behavior according to your society, but in a very extremely way. Just like, we will not anticipate you to have sex in public, but if you are hypersexual, you might have sex in public, especially with the Clover-Bosi syndrome. And that emphasizes the role of the amygdala. So generally, let's have a summary of the limbic system in the behavior. We had some subcortical structures which we've acknowledged to be very important, but also part of the limbic system, you cannot ignore the limbic cortex. So limbic cortex is a ring of the cerebral cortex that normally surround the subcortical limbic structures. It acts as a transitional or associative zone. This means it receives signals from the rest of the cerebral cortex and passes them direct into the limbic system and sends feedback from the limbic system back to the cerebral cortex. What role do they have? Serves as a cerebral association area for behavioral control, linking thoughts and emotions with actions. The anterior temporal cortex part, if this area is damaged, they'll present the same symptoms as that of the disrupted amygdala. So they'll still have the Clover-Bosi syndrome. The posterior orbital frontal cortex ablation, what happens when this area is affected? The individual might present with insomnia and motor restlessness. The anterior cingulate and subcallosal gyra ablation. So remember, these are just part of the limbic cortex. When this area is disrupted, how are these people are likely to present? These areas normally inhibit rage centers in the hypothalamus and the septum. Their removal might result into uncontrolled rage and the violent behavior and loss of emotional regulation. The limbic cortex acts as the interface between the conscious cerebral cortex and the emotional limbic system. It plays a vital role in processing sensory and cognitive signals into meaningful emotional and behavioral responses, modulating rage, sex, drive, restfulness, curiosity, and motor activity, supporting the complex behavioral associations such as linking smells, tastes, or sounds with memories and actions. And that is the brief part of our behavior. So we'll just be having a brief session of the brain activity. So we'll majorly be focusing on the sleep. So that is the behavior, the physiology of behavior. So next time we'll start with the brain activity, just focusing on the sleep part.